I was born on the Rock of Gibraltar, and when I was growing up there was a dictatorship, and led me to my interest in microbiology and infectious disease. All work in an interrelated ecosystem. The more we think about all our different senses, how we use those to communicate, I think the more trustworthy you become. Trap of saying that, data are the one truth. And data haven't changed. They're both accurate depictions.
You can see why you call yourself a storyteller as well as a medical affairs strategist.
That actually maybe healthcare at its essence should be more about collaboration rather than being a competitive endeavor. Now, instead of being an expert in your own medicine, now you're starting to become an expert in the healthcare system, and that now we were putting all this, I call it medical risk, onto people who were not scientifically or medically trained. The healthcare industry as a whole is still very siloed.
Things have got to change, right? The system is just not working.
You mentioned AI. I mean, what it doesn't yet have, right, to my mind, is a sense of purpose, of intent, right, and say consciousness. And what I mean by that, it was really not that it ignored rules and regulations, but it came up with the result that
technology is advancing much faster than a new way of delivery or innovating or new regulations or ethics even.
Putting those people in a position where they can truly make an informed decision. Be deliberately polemical, challenge the status quo, think coming to something better.